EEG 101, a patient's experience. What is an EEG? Have you ever had an EEG? Do you know someone who has had an EEG? Why would someone have an EEG? These are some of the questions I'm going to address in this presentation. EEG is an abbreviation for electroencephalogram. It's understandable why they would want to shorten to EEG. The first EEG recording was July 6, 1924, during neurosurgery by Hans Berger. An EEG is a test that allows the doctor to see a snapshot of how your brain is functioning or how your brain is working. Whereas an MRI gives a picture of what your brain looks like. An EEG test allows the doctor to see a visual representation of waveforms in a pattern on a monitor screen of the neurons and the nerves in your brain and how they're talking to each other. Did you know that depending on what you're doing or what state you're in, awake or asleep, your neurons will create different patterns on an EEG? If you are awake, asleep, reading, or having a seizure, these patterns all look different. And your doctor or an EEG technologist know what these patterns mean. A couple of things to know about an EEG. The EEG technologist cannot read your mind or know what you're thinking. Other than the placement of the electrodes on your scalp, it should be a pain-free application experience. Depending on the length of your test, your doctor has requested, which will be discussed with you before the test. This will determine how long you will wear your EEG. Your doctor may request that you stay up later than usual. They may call this being sleep deprived. During an EEG, the tech will attempt to capture multiple states, such as awake or drowsy and asleep. Sleep is very important to try to capture during an EEG, especially in children. Sometimes there is activity happening in the brain that is easier to see when you're asleep. This gives the doctor a broader picture of what might be occurring in the brain. Being sleep deprived helps to increase the chance that you will sleep during your EEG. The doctor may ask you to refrain from caffeine and sugar prior to your test. Any directions concerning your medication should be communicated to you, the patient, directly from your doctor. It is advisable to bring all your medications with you. Your technologist will make a note of the medications you are taking, the amounts and the times in the EEG notes section during your test. To make the process of hooking up the EEG faster and more pleasant, the patient will be asked to have clean, dry hair that is free of products like hair gel, hairspray, oil, leave-in conditioner, etc. Wearing comfortable clothing and ensuring to use the restroom before you start your EEG application are also beneficial in making the test a more pleasant experience. It is also encouraged, if the patient is a child, that he or she brings their toys or blankets to assist in making the child feel more secure and comfortable during the process. Bottles, drinks, snacks, and entertainment such as their favorite cartoon to watch during the hookup may help to distract from the application process. When it is time for your appointment, whether in the home, in a clinic, or in the hospital setting, the technologist will ask a range of questions. The answer to these questions will assist the doctor in seeing the whole picture of why you're having an EEG. Questions such as, tell me what your events look like. When do these events take place? Is this the first time this event has happened? If not, when did they start? What do you feel and remember when you are having these events? If the patient is accompanied by someone, they may be asked to give a description of what occurs during these events. Is there anyone else in the family that has these or other events? Is there a history of epilepsy in the family? Has there been a recent fall or previous injury? The technologist will conduct a brief history and record the medications that are currently being taken. The technologist may also inquire if hyperventilation or breathing exercises will be conducted. Do you have sickle cell disease, moya disease, asthma? Was there a recent stroke, cardiovascular or pulmonary disease? Is there anything preventing you from doing cardiovascular exercise? The technologist will explain the procedure of the application of the electrodes, the length of the study, and what to expect during the EEG, and the process for disconnecting the EEG once the test is complete. The technologist should also be able to tell you when your results of the test will be ready by the doctor. You may have your EEG conducted sitting up or reclining in a reclining position or lying in the bed, depending on where the test is being administered. To begin the electrode application process, the EEG technologist will measure your head to ensure the correct placement of electrodes. This is a simple process, but extremely important in allowing accurate placement of electrodes. The 10-20 system is the standard electrode placement and is based on the relationship between the location of the electrode and the underlying area of the cerebral cortex. This method was developed to maintain standardized testing and have the ability to compare studies to one another. Your brain has many lobes and sections. There's a right and a left side of your brain, and each side is separated into several lobes. These lobes are frontal, temporal, parietal, occipital, and the insular lobe. Neuronal activity in each of these lobes will represent differently. Frontal lobe activity may cause someone to wake up at night and begin marching around. The occipital lobe activity may cause the person to see starbursts. Temporal lobe seizures could cause fear or panic, or they may experience deja vu. Parietal lobe seizures may present as heat or numbness or electrical sensations. Insular lobe may present as suffocation or breathlessness or taste auras. These are only a very few examples of how seizures may present themselves from the different lobes of the brain. Therefore, measuring a patient's head is extremely important. Ensuring correct electrode placements gives the doctor the location of the activity, which will assist the doctor in determining what is the best course of action that will assist the patient. After the technologist has measured your head, they will begin to prep the area to apply the electrodes. This is typically done with a cotton swab and a small amount of scrub, which will clean the area to make it free of oils or dry skin to allow the very tiny electrical signals from the brain to transmit to the EEG system. This is a gentle process and should not cause discomfort. The electrode cup is at the end of the electrode wire, which is connected to the EEG system. The electrodes may be left as is, or there may be glue applied called collodion to help attach the electrodes to the scalp. There also may be gauze bandages wrapped around the electrodes to help secure the electrodes. The wires will then be bundled out of the way to prevent the patient from tugging on the wires and disrupting the connection to the scalp. A small amount of conductive paste, which assists in the transmission of the electrical signals, is applied to the cup and the skin that has been prepped. Depending on the type of EEG you're having will depend on the number of electrodes used. The standard EEG hookup is the 1020 system, as we talked about earlier, but additional extra electrodes may be added at the doctor's request. Once the hookup is complete, the technologist may begin the EEG recording. During the beginning of the recording and possibly throughout the recording, the technologist may conduct stimulation protocols or activating procedure to attempt to elicit activity during the EEG. Hyperventilation may be conducted. This is a series of guided deep inhales and exhales for 3 to 5 minutes. To assist in breathing exercises, the technologist may provide a pinwheel or a piece of tissue to help the patient conduct the exercise. Patients who have absent seizures may experience events during deep breathing exercises. You may experience being lightheaded during these deep breathing exercises. You also may feel tingling in your extremities, in your toes and your fingers. This is a photic stimulator, like the one I use. This allows the technologist to conduct photic stimulation, which allows your doctor to see how your brain reacts to flashes of light. This stimulation procedure consists of multiple sequences of lights at different hertz, flashing approximately 30 centimeters away from the patient's face. Your eyes may be open or closed or both during photic, depending on the lab's protocol. The flashing light may produce events that may be associated with seizure activity. Also, some patients may experience seizure-like activity that may need further investigation. Once the stimulation protocols have been addressed, the rest of the EEG may consist of trying to sleep, or if an epilepsy monitoring unit or an at-home ambulatory EEG, the patient may be asked to continue their daily routine as normal as possible. Depending on the type and the length of your study will determine what happens next. During the study, you may be instructed to push a button to mark patient events. This will help the doctor realize when you're feeling something different or if you're actually having one of your normal events. You may also be given a piece of paper to document the events, or when you eat, when you went to sleep, when you woke up. Once your study is complete, the electrodes will be disconnected and you will need to wash your hair due to the scrub, the gel, the paste, and even possibly the glue, the collodion, depending on what type of EEG that you've had. The EEG will then be sent to your doctor to read and determine the outcome of your EEG, which will then guide the next steps in your journey's process. EEG systems have come a long way over the years. Where it once was as large as a desk, now it is so small you can actually wear the amplifier. An EEG is a necessary diagnostic tool to determine how your brain is functioning. It helps your doctor determine the next steps in your journey.